Let's go, chapter 21. Oh, we're getting so close to the end. Other therapeutic techniques. And some of this is going to be kind of reviewed too. Can y'all see that? It's kind of bright in here. Yeah, hold up.
Why'd you chug it?
Yeah, I always chug. I'm not a sipper.
I know I could totally
Your coffee?
I know,
I'm like that whenever I get
eat
anything
one
from
later.
Starbucks. I drink it and like
Again.
suck it.
It doesn't matter. Give me this.
It's fine. I brought tuna
My
and
Starbucks not
So did I.
then I have an apple and beets. So that's like doesn't count for calories, right?
healthy, yeah.
Yeah, so I can eat 2 fry pies. It's fine.
I like that.
My husband informed me my
Balance.
bread was not the problem with my weight gain, so.
All right, so keep making it. All right, many techniques have origins in the Far Eastern philosophies of, this is important, Japan, China, and India. So most of our massage techniques have been based off of their cultures. Some of these techniques would be, I don't know why it says chair massages in here. Oh yeah, we're going to learn chair massage today. Right, chair massage, stone massage, so hot stones, reflexology, acupuncture, for us it'd be acupressure, shiatsu, chakra energy healing techniques. Those are some techniques from the Far East countries. Chair massage. I actually need to print that off. It's me. I'm just kidding.
No.
It's probably the fry pies. Mine's CK1.
Really?
Yeah.
That's old.
Heck, I'm old. I'm old, man.
I remember everyone used to wear it. I sprayed it
It's
over
like a
my
universal-
I did when I was like middle school and high school and all through my 20s, and then I never had it again until I went on my Alaskan cruise. I think it was Alaskan. No. One of my other cruise, my Bermuda cruise. The internet gets to hear this story. And that was my first cruise ever, and there's a lot of shopping on there, and they have really good deals on like perfumes and colognes, and there was a 2-pack of CK1, and I bought that bad boy. So I have 2 bottles of it. You're welcome. And I like it because it's not overpowering, and it's fresh, and it's a unisex, so I don't smell too girly, and I don't smell like a man. Not that it would matter, but because I've gone both ways with it. If I like the smell of it, I'm going to spray it on me. Anyhow. Chair massage. Sorry, guys. That was really off topic. Thanks, Kiki, for my ADHD moment. So for a chair massage, it's good because the client doesn't have to get undressed. It can be offered remotely, so you can easily just take your chair places. It's not that easy, trust me. They're still heavy. So this would include like airports. It says planes, but I've never seen a chair massage on a plane. But trains, gyms, salons, beaches, state fairs, movie sets, sports events, corporate events, etc.
You gotta be in first class for those massages.
What, this? The good thing about this, too, since they don't have to get undressed, it can help reintroduce safe touch to victims of abuse. A chair massage is typically 10 to 30 minutes. I think 30-minute chair massages are super long. I like to keep it between 10 and 15. I think that's the sweet spot. It's low cost compared to doing a full body massage, they say. Most people for chair massage do like $1 a minute, or maybe it's a 10-minute massage. You can do 15. You can even do more, or $20 for 10 minutes. Whatever you want to do. Volunteer. You can volunteer places. And also, the cost is low because you're not using a lubricant and you're not using linen. However, typically there's a face cradle still. You can get the disposable ones that we have here. Yeah, they're not too bad. And then I would always bring like a disinfectant wipe with you so you can wipe the area after people, especially the face part. My advice is if you do chair massage, they have face cradle covers you can put over your face cradle that is like waterproof. If you get that, because I would get that because if you keep wiping your vinyl with the disinfectant, it's going to start peeling away. So if you want to take care of your equipment, get the waterproof cover first, and then you can just put the disposable one over it. So techniques and safety for chair massage. So you're not going to be doing the same techniques on a chair than you can do on a table because you don't have that glide. So most of it's going to be friction and compression moves, tap potement, acupressure, and stretching. Very minimal. Because really you're only working from the low back up. You can't really do hips and glutes and legs and feet in a chair. Aries massage would include head, neck, shoulders, back, arms. It says hips, but the top part of your hips because you're sitting on the rest, right? I also include hands in here, so that's not on here. Hygiene, use a face cradle cover, right? You can use a disposable cover. Hair nets, you can get a pack of hair nets. That's pretty cheap. And worst case scenario, if you forgot and you're doing a chair massage event last minute, get yourself some paper towels. You can rip 2 paper towels in half, and then you have a face cradle cover. But don't fully rip them in half. You know what I'm saying? Like keep them connected at the top fourth of it. Sanitize the vinyl surfaces after every client. Do this because that's gross. Especially the face cradle and the arm rest. And then you can use antimicrobial or some kind of disinfectant wipe. And for you're typically not going to be near a sink, right? So you can either glove up or you can use hand sanitizer. I have done all of these things. The bad thing with the gloves is after a while, your hands, it's hard to get the gloves on because, you get hot and sweaty. And I've done that. I've done hand sanitizer with the combination of the antimicrobial hand wipes. They have the actual wipes so that you can get some of the grit off. And if you are at a place where you can hand wash, I would, every few clients or whatever, if you can, disappear and go wash your hands. All right. But most of the time, you're not touching much skin other than what arm is being shown and maybe their neck a little bit. All right. Stone massage. We're going to go diving in deep next semester with this. So you guys are going to learn a full hot stone massage next semester. It's awesome. So we're going to go over this obviously in detail, but when we're working with stones or even equipment, what happens is that equipment or this hot stone becomes an extension of our hands. We are using them. I'm going to take this remote control, for instance, and you're keeping it in your hand and you're using it to do the massaging with. So just imagine it's another part of you. The most important thing that I have highlighted in red, it's hard to see on this blue background. Never place hot stones directly on the client's skin unless the stones are in motion. So you see those pictures of hot stones where they're down the back? That's not real life. All right? That's just for aesthetic reasons. Now, you can place them once they've cooled down enough. And I'm going to teach you guys how to do that. So a lot of times I'll use the stone when it's at its hottest that I can hold. Use that once it cools down enough that I can actually set it on my inner arm and leave it there without it burning me. That's when you can place them and the client can continue to feel like the residual heat until it dissipates. Okay. So hot stone massage, they say, is less strain on the hands. I'm going to disagree with this statement because you are holding something. So I feel like it's a different strain on your hand. But the good thing, the reason why they say it's less strain is as you're using this heat, you're now using heat on your client. Heat, remember, warms up soft tissue. So you can get in deeper, quicker without having to do all that work manually with just your hands. So that's probably what they're meaning by less strain. And typically, the deeper pressure is more tolerable for the client because it's warming up quicker. All right, so you can, like I said, get deeper much faster. It promotes healing to injuries. So remember, heat relaxes, promotes circulation, and then when that heat is gone, you have like a pumping action when the body tries to rid the surface area of the temperature increase. And then you can also do contrast therapy. So you can use cold stones as well. We're going to go over the different kinds of stones, but I always keep cold stones in my freezer. You can keep them in the fridge if you don't want to be that cold, all right? But you can kind of bounce between the two. If somebody has inflammation, you can use a cold stone instead of a hot stone. If somebody comes in with a terrible headache, a lot of times what I will do is we have these little heat pack, rice packs. I'll warm that up, throw it in a pillowcase so it doesn't touch them directly, right? I'll put that under their neck, and then I'll go get my cold stones out of the freezer, and I'll do the sinuses and the head massage with the cold stones. So you have the heat and the cold, and it feels really nice. It is very nice. Contraindications and cautions. I don't even do this anyhow. Prenatal, it says spot treatment only. Why? Because hot stones can raise the core temperature of the body. We don't want to do that when they are growing a human. When in doubt, just don't do hot stones on someone who's pregnant. So I just don't. It's not even offered as an add-on for my pregnancy massages. But if you feel like still doing a little hot stone on the neck and shoulders or whatever, and that's your, prerogative, okay? But you should listen to my advice. Cancer. So someone who has cancer typically will have a weakened immune system. So use caution with these people, with the cleanliness of your stones. You should always sanitize and wash your stones between every person. There's different kinds, and we're going to go over that too, of heaters for your stones. There's the typical one that looks like a crock pot and is full of water. And then you have the waterless ones. I recommend getting the waterless ones because they're easier to sanitize in between people. You don't need as many stones because if you have the crock pot kind, you cannot put your stone back in the water unless you fully clean and sanitize that entire reservoir of water. Does that make sense? And I've heard of spas, like high-end spas, doing that, and they just put the... Like, not only is there oil from your stone, but there is dead skin cells and whatever gunk. What if they have a fungal infection on their skin or something? Super gross. Or they're, like, rubbing it on somebody's feet, and next thing you know, you have that on your face. You got athlete's foot on your eyebrows now. Sorry, I'm gross. Rewind back to cancer. If you're using cold must be monitored in patients undergoing chemo or radiation because of peripheral neuropathy. Heat as well too. Like people, they might not be able to feel and give you a response on how hot or cold it is. You might need to also modify the hot stone temperature, maybe a little bit lower. Avoid massage with the stones over any ports. Now, it's easy to, how do I say this? It's easy to modify the temperature. All you got to do is set the stones out for a little bit before you use them. If you have a crock pot situation, if that's the route you want to go because you just like that better, which is what we have in the school. We have both the waterless and the water, the crock. You can lower it so that it's not scorching hot. The main rule is if you can't hold it, it is too hot for your client. So next, we're going to talk about cautions with older clients. Again, we might need to adjust the temperature. Older clients tend to have thinner skin, right? So you might want to drop that heat down a little bit. Avoid areas near pacemakers, right? In clients with diabetes, be very careful with extremities because of neuropathy. They might have that decreased sensation and they can't tell you if it's too hot. Next thing you know, you're burning the crap out of their feet. Be vigilant in checking color of the skin. So the skin might change depending on what's going on with the stones. The stones are really hot, right? So continuously check the situation with that. Avoid insulin pumps. That's a given. Avoid full body hot stone massage in severe cases. So if somebody has maybe diabetes that they're not really taking care of, I wouldn't do hot stones on them. High and low blood pressure. Avoid full body massage with uncontrolled blood pressure. Same with any heat therapy, okay? Caution with extreme low blood pressure. So anybody whose blood pressure is not controlled, you're probably not going to want to do hot stones on them. Multiple sclerosis, or MS, would be, whoa, what was that? A hiccup? Spot treatment only, all right? They say it's contraindicated to do full body massage on people with MS. Types of stones. So that top left stone, the black, smooth-looking stone, those are called basalt stones. They are the most commonly used stones in this profession. Why? Because they retain heat longer than other stones. Some other stones that might be used would be soapstones, which is a buffed stone, right? River rocks, jade stones, and marble. Marble stones, that's what I have, are the best for cold application. They retain the cold longer than everything. Think about just stepping on a marble floor, and it always seems kind of cool, right? So that's what's going on there. So there's different sets that you guys can get. You guys can get sets of stones that are already, shaped like a circle. If you are one of those people that wants to go pick your own hot stones, because there's always somebody, make sure you find ones that are soft and smooth without any jagged edges. I feel like that's a given. Make sure you sanitize them very well before you start using them on people. And also keep in mind that they're going to be all different shapes and sizes. So you're probably going to have to put them in a crock warmer with water. A lot of the waterless devices or heaters are going to have stones that are perfectly shaped for the container. And they're not going to fit in those. Right. Heating stones. Professional stone heaters are the safest way to heat massage stones. I have to do this spiel. And then they say what not to use. And this is really funny. The first one's crock pot. Well, all of the professional ones are based on a crock pot idea. They're basically crock pots. All right, so I think it's because some crock pots, you can't control the temperature. They're just high, medium, low. And then there's crock pots that are a little more precise with the temperature. But they say not to use them. Another one not to use is a turkey roaster. What? Electric frying pan. I have an old boss that would use these. It actually worked out quite fine. So what we did is we wet a towel, fully saturated, put that towel in the little heater. You know what I'm talking about? It has a little plug and you turn it to 200 all the way up, all right? If you just do the warm setting, it's totally fine. And it steams them. All right, so that, and then it was really easy to sanitize that too. But don't use it, it says. Warming trays, heating pads. I also have heard of a lot of people using heating pads. They just fold the heating pad in half and put the stones in it, which maybe that's best for like traveling, but now they have traveling hot stone warmers that connect to your car, and then you can heat them as you go to your client, right? Walks and towel cabinets. So towel cabinets would be your hot towel cabinets that you would put the hot steamy towels in. I've also heard of people using those. But again, for all of these non-professional stone heaters, these alternatives that people might use to save money, the main reason we want to not use that is we can't control the temperature. Okay. Cleaning them. So stones in the water, if you're using that method, must be cleaned between every single client if you're dropping the stones back in. Now, you can have a little tote, what am I talking about? Little container or bowl that you put all your dirty ones in and just have a lot of stones so that you don't have to change out the water if that's the route you want to go. And that way you only have to disinfect the stones and then you can put them back in after they're clean. So use antibacterial soap and water. I actually have scrubbies, which are in there. I get like the nail scrubbies, and I'll use that or any kind of scrubby and really scrub them. Now it says if you're using the water version, essential oils can be used in the water to reduce the bacteria, but never as a substitute for soap and water. Be careful with this because some people might have allergies too, but you can throw in a little bit of tea tree oil if you want to keep them cleaner, right? Because tea tree oil is one of the main ones that's antimicrobial, antiviral, antifungal, anti-everything else, basically. It also smells like death, but it's okay. So typically what I would do with the stones is scrub them, and then you can spray them down with an antibacterial spray after washing them with soap and water. So the soap and water obviously is getting rid of the oil that you're using on there and the dead skin cells and, you know, the debris, right? And then the spray is going to disinfect it. Then you can rinse it off, right? They suggest using something called Pure Green 24, which is actually pretty awesome and pretty expensive. So as long as you find an antibacterial spray that kills viruses and fungal and all that, I'd say it's safe. But Pure Green is awesome. Working with stones. If you are directly putting the stones on a client, make sure there's a barrier. This would be a towel. Maybe you're going to place them in the sheet and blanket are still on their back, and you can place them, a lot of times I'll do at the sacral area, so they're kind of getting some of that radiating heat without it being super hot. So always make sure there's a barrier between what is hot and what is their skin if you are placing and leaving. Remember, don't place unless they're moving. Keep the hot stones moving and never leave it on their bare skin, right? If the stones are too hot for us to hold, they are too hot to use. Introduce the heat through your warmed hands, which we will do when we do the demo, before touching your client with the stone. So what I mean by that is, as I'm using my stones, I like to use lotion because it cools it down, but oil is much better for this, but I'm so used to that. The lotion, that's what I use. So I'll have the hot stones in my hand. I'll place them in a spot that aren't touching the clients. Usually it's on their glutes, right? And then my hands are warm from the lotion, and my lotion on my hands are warm, and I put that on their back first. and then I'll grab the stone and get some of the heat distributed into my hands, and then I'll do the same thing until I can actually hold them a couple seconds without them burning. So that's how I do it. So make sure you introduce the heat. So the reason why they tell us to use professional stones is the stone should be between 120 and 130 degrees Fahrenheit. Some people think that's too hot. So if you want to drop it down a little lower, you can still drop it down a little lower. And everybody withstands heat differently. Some people are like, burn me, I take Satan showers, right? And then some people, like, you feel like you've really, like, cooled it down, and they're still like, oh, that's still warm. So some people are just more sensitive to things. I will do stones on children once I've lowered the temperature enough that it's kind of just a warm. Actually, just did that this week. She's cute. Cold stones. So if we're using cold stones, they may be placed on the skin after removing from the ice or the chiller. So you can directly place the cold stones on them. They're going to lose their cool pretty quick, just because our body is so much warmer than that stone is, you know. They say the best lubricant to use with stones is a water-soluble massage oil. The oil gives you the glide you need, but I noticed that it keeps its temperature longer with the oil. So if that's what you want to do, use the oil. Reflexology. We are also going to do this next semester. Diving in deep. That's my phrase of the day.
Will we be able to do reflexology?
Yes, but you won't be called reflexologists, if that makes sense. Okay, so a reflexologist is somebody who went to school mainly for reflexology, and it's a lot more of a detailed session than what we will be able to do. But since with our license, we will be able to do hands-on stuff, we can do a version of reflexology. So if you go to a reflexologist, like a real one, they're going to be like, oh, you have something going on with your liver. Well, we're not allowed to diagnose. That's why we can't do that. So you might find areas. I do reflexology, and it's not a foot massage. It's like acupressure points on the feet. So a lot of people think reflexology is like a foot massage, but it's not. I do incorporate some massage because it feels good with the whole routine. But we'll go over the reflex points in the feet. A reflexologist also does hands and ears, where I'm not going to go over that. I actually don't do hands and ears because I never did that training. I just did the foot training.
So say we take a class for that. Will that count as credits for us?
What do you mean, count as credits?
Like hours? Yeah, like CEs.
Like for school credits? No. You can take it once, like you can take a CEU, I think now. But after this, if you take CEUs, that just gives you more knowledge in that field or that modality. And some CEUs get you to the point where there's different levels, like level 1, level 2, pro or master, and then you can just have bragging rights. So that's basically what that is. Or certified. Some of them are certified, like certified lymphatic drainage therapists and stuff like that. So, yes, we can do reflexology, but we will not be called certified reflexologists. All right, so reflexology is the art and science of stimulating the body's own healing forces by locating and stimulating certain points on the body. These points, they say, affect your organs or the functions in distant parts of the body. You're like, what's that mean? I'll show you in a second. When an organ is distressed, it becomes inflamed and congested, or congested. This inflammation triggers the brain to send messages to the corresponding reflex points. So this is what they say is going on. Now, some of you might not believe in reflexology, and that's fine too. When this point on the body that corresponds with an organ is touched, it might be kind of tender. So it might feel harder for us. There might be swelling in that spot. It might be sensitive to the client. And that could indicate that something's going on with that specific reflex point that would affect that organ. Or that just means that spot in their foot is sore. That's what I tell my people when I do the reflexology. I'm like, it could be this, or maybe that spot's just sore. You know, doesn't necessarily mean that they're going into kidney failure or whatever. Now, I do have a client that I work on their feet, and she's missing a kidney. So the kidney that's still there, there's always a little more tenderness on that side because you have two kidneys. And each kidney is on a different foot. So she usually has tenderness in the side that's probably overworking, right? Excuse me. Typical reflexology sessions could be anywhere from 20 to 90 minutes. I do 30 minutes and 60 minutes. So my 30-minute is basically just an intro, and I'll focus on an area. Maybe they're having sinus problems, so I'd focus on everywhere from the toe and up. All right. My hour sessions are full, both feet.
I wish I did that for you and Theo. With sinuses.
Can't I zoom? Yes, I can. So here's a little diagram. Now, real reflexology is much more detailed, like if you were a reflexologist. But this is kind of like a base, a very basic version, right? So if you put your feet together and you think about where all the organs are at in the body, it kind of gives you a map. So I'll start from the top. Tips of your toes are reflex points for your brain, your head, right? Your sinuses. We're going down. Glands, so that would be your hypothalamus and pineal gland, right? Work your way down the toe. That's going to be your throat. Does this make sense? The spot right here below the toe, right, getting into the foot, is going to be shoulders. Do you see where I'm going at, right? Lungs are going to be the ball of the foot, which is our chest. And then we're working our way down. Diaphragm. You have heart. You have gallbladder, right? The whole arch of your foot is anything digestive, right? And then we're going to go very down to the bottom, would be your reproductive reflexes. That's why we say not to do a lot of heel and ankle work on someone who's pregnant unless they're about to pop within like a week or two of having the baby. Or they're late, then you can hit all those reflex points. But it's a map of the body. I don't know who figured this out, but I think it's kind of cool. Chinese medicine, geniuses. Energetic manipulation. So we're going to talk about some energy stuff, which I just know a little bit about. So does anybody in here do energy work? Yes? Okay. There's always someone in each class too. It's cool. So bioenergy is a vital life force in all matter. Different cultures call this life force energy different things. Islam calls it Baraka. Barack Obama? I'm just kidding. Sorry. I'm not funny. I'm not funny. Hebrew, I'm going to mispronounce all this, is Ruach. India is Prana. China, Japan, and Asia all call it Chi. Chi. So if you hear the word Chi or Ki or whatever, we are talking about life force energy, right? The most prevalent form of energy, that's a typo, form of energy work practice around the world today originated in China. So here they are doing more things. And then we have traditional Chinese medicine. You'll see this abbreviated as TCM. This is the Comprehensive System of Health and Well-Being. That's it. All right, here's a yin-yang symbol. All right. let's talk a little bit about yin and yang. So they say yin and yang is a long-time disharmony between the yin and yang. And here's the results for the diseases, all right? So without one, you can't have the other. So yin is female. Yang just rhymes with is masculine. That's how I remember it. Sorry, guys.
Yin and Wang.
Yeah. Yin is female, feminine, yin. Yang is male. All right. So the dark part of the yin yang symbol is the feminine part. All right. So yin would be introverted, dark, night. What is with that? Why did we get dark night? It represents low. So you see how the bigger bulbous of this is lower. All right. It represents cold, inside, contracting, passive, deficient, weak. Right? Now, yang is your extrovert. It is light color, represents day, high, like think higher power, right? Hot, outside, expanding, active, excessive, and forceful. So typically the yang is going to be a little more of the aggressive, in your face, right? Like the man. Like the man. Just kidding. All right. More about Qi. They're very into elements in the Asian cultures. They're very into feng shui. So everything has its place. Certain elements have different characteristics. Certain elements tie in with different organs as well. So the main 5 elements would be your fire, earth, water, wood, right, and metal. So the 4 elements you think of typically would be your water, earth, wind, and fire. Well, they like to throw in metal, all right? Each element contains qualities that range from physical organs to emotional stress and different seasons as well. So let's zoom here for fun. So wood would represent your gallbladder, your liver, right? It would tie in with the eye, tendons, anger, spring, wind, all right? Calling a sound, it's associated with green. It says sour, the flavor sour, all right? So there's east and time zones. I'm not going to go into detail on this with the quiz, so don't worry. But this is just something cool to see. But you kind of see how each element is affected by different things. Right?
There's another part of that. And I may be wrong, Jamie, you might know. Is it the koshas? Like you can do like a little test on like what season and like how to eat based on the season and balancing.
That's pretty cool.
Yeah, it's really cool. It's been several years since I'll have to look and see if I have any.
That sounds like an Ayurvedic type thing,
It
where it's
is.
like full body wellness.
Yeah, and I can't
There's
remember
probably
what it's
something
called.
to it, because if you think
Oh,
about
there absolutely is.
how our diet is specifically supposed to be based on what grows around us and the vitamins we get, and now we trade and we get things from around the world. So,
Like in the winter months, like we crave those warm, spicy foods.
No, but on a
because-
soup kick.
Yeah.
me too.
And it
I
is
mean, like
Soup.
4 types of
Say,
soups in
it's
the
based on
last
the
weekend.
season.
Yeah.
It's totally based
And
on
what
the
your
season.
body needs.
Yeah.
It's. I mean, we're.
And like wanting to go to bed earlier because of the time
I
change,
know,
but
I'm
also,
hibernating,
and that's
yeah.
totally,
Visual.
it's winter, it's that time to store.
Yeah.
And what
Yeah.
Professor, and when I was in exercise quiz, he would say, like, if you wanna reset your body type and your metabolism to how you're genetically programmed to be,
Yeah.
you need to live like the caveman did. And go back to the caveman diet is if you can't hunt it, fish it, or grow it, you don't eat it. Yeah. And
Yeah.
you only eat seasonal foods for whatever season, for what climate you live in. And that
Makes sense.
you eat only during daylight time and you only sleep during nighttime. and so you stay with the rhythm of the earth.
And you probably have so much,
Yeah,
you're so much more healthy.
yeah, and he would say like that works every time to reset how your body is meant to be. It doesn't mean that you'll be a thin person. It doesn't mean that,
You're
you'll
just healthier.
starve or anything, because people are so used to eating at all times of the day. And he said that we've become so like, the access of, like you said, trading from around the world is so easy anymore that we've just overindulge ourselves. And our idea of how many calories you actually need to live
Yeah.
is completely different than how your body's designed on what it can actually live on.
Yeah, we eat way too many calories. As I bring Amish pastries. Fried pies are
See,
light.
that would be something you're not allowed to eat, because you can't hunt it, fish it, or grow it.
It's like going to a real fancy restaurant. You're like, that's pollution?
Listen, they grew the berries.
You know what I mean.
Build the flour.
But like you harvest corn in the fall.
Yeah.
So corn is designed for your to stay hardy through winter.
Yeah.
And you're like your grains and stuff, they're not designed for hot
Summer.
weather intake. They're designed for cold weather.
Yeah, and if you think about hot weather foods, a lot of them are very water based.
Yes. Fruits.
For
and
hydration,
Right.
right? It's
So,
cool. It's
He had, I
let's
mean, that
just
was
all
back in
change our diet.
1995. So his theory back then was like,
He's smart.
I had one that I was, thinking about the blood type I was telling you about with my brother did that. You can eat your diet off your blood type and what you're not supposed to eat.
Yeah.
yeah.
A
Which I'm
positive.
A positive.
We can save each other's lives.
Yeah, and I can't tolerate red meat, and it says to avoid red meat.
I can
It makes me
save all of your
constipated.
lives.
Oh man, give me some
Are you
steak.
O? My
I'm
brother
positive.
was
O's.
something to it.
That's super cool. We're gonna have to Google that later. See what foods we're supposed to eat based on our blood
It's a
type.
huge list.
Yeah.
I printed
I'm
it
gonna
on
look that up.
my house.
All I can say is I feel better when I'm on keto.
We're not supposed to eat all the carbs that we're eating.
No.
Yeah, keto basically is the caveman. Yeah.
Actually, keto is before the caveman diet, because it's actually carnivore that's more of the caveman diet.
Herbivore. Omnivore. We're omnivores.
It's an even stricter keto. Yeah, you'll have the yeah, you know,
All right, we got what, 2 slides left? All right, so traditional Chinese medicine is, they like to also revolve around 12 specific organs. Here are the organs: lungs, colon, stomach, spleen, heart, small intestines, bladder, kidney, pericardium, the triple warmer. So this is what controls fight or flight, right? Triple warmer, they call it. Fight or flight. It affects your fight or flight. So your sympathetic and your parasympathetic system. 10. 11 is gallbladder. 12 is liver. So along the 12 organ meridians are areas of high conductivity, and they call those acupoints. So see this picture over here and how there's all these different colored lines? Those lines, they call these lines the meridians that are based on this. See this teal one, this light, bright green or bright teal? That's your kidney. I just picked that one out because it caught my eye. So along this would be your meridian, and then along this could be acupoints, so points that might stimulate said organ. So these acupoints are easily influenced by pressure, so that's why they would do massage or acupuncture or acupressure. Heat, electricity, needles, and touch. Some methods used, like I said, would be your acupressure, acupuncture, shiatsu, and tuna. Not to be confused with what me and Hope are eating for lunch. Some other energy-related therapies.
I need that done.
It's you.
Who did that before me?
That's such a good move. Don't do this, Theo, to your husband with his inguinal hernia. Marma point therapy. I don't really know much about that, but that So what these energy therapies are doing is those meridians or those energy points, they say, have stagnant energy. Stagnant energy can mean dysfunction or disease. So what we want to do is open these blocked points so that the body can maintain homeostasis. All right, so Marma point therapy moves your stagnant and blocked energy by either arousing or calming something called the doshas. So we're either calming them down or stimulating them. Thai massage. Woo! Uses compression, joint mobilization, and acupressure during the treatment. The client is fully clothed. It is not a massage. And true Thai massage does go along the meridians. I don't do that. I just do the physical form of it for stretching purposes. Reiki. That's very, very common. Most of you probably heard of Reiki. So this practitioner uses something called the power of intention. Positive vibes. A lot of time they bring this intention from a higher source, they say. So whether you believe in God or you're Buddhist or you're Hindu or whatever, in most religions there is a higher energy source. So what they are doing, it's not satanic, it's not weird stuff. It's bringing almost like a connection between a higher power to help bring that energy through the practitioner, they say, to help heal or open up the chakras.
I have something to say on that.
Yes.
I learned a non-religious form of Reiki.
Yeah.
Which is where you open up your channel and you allow previous page life force energy.
That's cool. Yeah.
Yeah.
I have a friend who said she
The
uses
higher force thing kind of threw me off.
Yeah,
Like,
so
it's
people
not quite like
so
that.
if people are atheists, it's whatever that person is feeling on the table, whatever religion they are, I tell them. So they don't feel uncomfortable. I don't do Reiki, like I don't practice it. But I have a friend who practices Reiki and she pulls the energy from the moon. She resonates with the moon.
Yeah.
So I think that's really cool. So it's whatever power you want to bring into your practice. But thank you. Polarity. This would be balancing positive and negative charges in the body to help the energy field as a whole. So a lot of these are very similar. Well, not a lot, because Thai massage has nothing to do, well, I can't say that. It's not this type of work, all right? Not quite the same. Just some meridians are being used. Therapeutic touch. So a touch-free form of energetic body work that goes beyond just the physical body itself. I don't know what that is. I don't practice that. But if you guys are interested in energy therapies, do some more research. Maybe get a session done with somebody. I have a Reiki master that works at the office once in a while, and she actually sometimes does Reiki classes. I tried to get that started, but nobody cared. Nobody has money. She's like, nah. So, she's a very calm human, and I really like her Reiki. And she's the only person where I've actually felt things during it. Like, when she's hovering, not even touching over my leg, I felt like a surge of energy, like a restless leg syndrome type thing. It was real weird. And then she told me afterwards that she kind of felt, not really seen, but felt like a presence, like a cat playing around my legs. And then I started bawling because my cat had passed away.
I've been mean to him.
Right?
Cat and dog. She's like, do you have a black cat and dog that's on the other side?
Oh my God, that gives me chills.
She's like, I just want to let you know they were here with you today.
Oh my God, stop it.
They're
My
buried
arm
in
hair.
Mine are buried in my backyard. They are.
Aw,
Yeah.
that's sweet. Yeah, so, I don't know, it gives you kind of like, so sometimes it can pass through the spiritual world. So you got to be very careful and not open up, the practitioner has to not open themselves to negative parts of the spiritual world. So that's why some people think it's like satanic, or people who are religious don't want to do it. Makes sense. Yeah, but I've also, and it's only happened ever with me and my wife, but we've heard this weird buzzing by the window when we've both had the session, like a like that happened during the session. And the girl that works, anybody who's worked in that room, I worked in that room too at some point, I've never heard that noise. And it has only happened when we get Reiki in that room. So that creeped us out. And then I'm like looking to make sure nothing's like vibrating over there. I'm like, there's nothing over here. And it happened multiple times. Yeah, so there was a weird energy thing going on there. But it's cool. Y'all should experience it at least once. All right, the chakras. So a lot of energy techniques revolve around the 7 chakras. I have no clue how to say any of these, but there's the crown chakra, the third eye, the throat chakra, the heart chakra, solar plexus, right here, sacral, and roots. All of these chakras, again, correspond with different emotions, right?
I have tuning forks that are tuned to each one.
Yeah, so do I.
I feel that one.
Yeah. Oh, it's cool.
It is really cool. And different frequencies heal or open different chakras or heal or do different things in your body. So I actually do sound healing. Nobody ever books it, but I know how. And I do it with the tuning forks and the singing bowls. It's fun.
That heart one right there.
Heart. So usually the chakras correspond with colors, emotional functions, and whatnot. All right. So the big one here, I like to use shark. Throat chakra. Location, they say back of the neck, throat area. This main function, if your chakra is closed here, has to do with communication. Does that make sense? Right? Yeah, and heart. So communication, expression, honesty, purification. The colors with this would be the blues, the turquoises, and so on. All right, so a lot of times you'll notice, and if you don't believe in this, think of it as a horoscope. All right? I can probably say any of you might have communication issues. All right? What? Of course. So when in doubt, just do it for entertainment purposes. But sometimes it's spot on and super weird when they say this chakra is full of energy. It's too open, all right? And maybe there's too much going on there. Or maybe there's this disease or dysfunction or an emotional issue going on. Cool. I need to get somebody in here to do Reiki.
When I did my